There's this phrase, time is brain, which refers to the observation that the longer you go without treating a stroke, the more brain is lost. It's estimated about 1 million brain cells a minute are lost after a blood vessel becomes blocked. And so we keep in mind as we're evaluating a patient, time is brain, so that we can get the treatment initiated as quickly as possible. A stroke is generally defined as a problem with blood vessels and the brain. It's separated into two major categories. One is a blockage kind of stroke, which we call an ischemic stroke. And the second is a bursting open of a blood vessel, so it's bleeding, a hemorrhagic stroke. The majority of strokes are the ischemic strokes, the blockage kind. It can happen for many different reasons. One sort of large category is where the blood vessels inside the brain itself get narrower and narrower and narrower over time, and then one will just finally block off. That's usually due to high blood pressure, diabetes, cholesterol, smoking, that kind of thing. A second type of stroke is when the blood vessels inside the brain are fine, they're normal, healthy, wide open, but something flies into it and blocks it off, like a blood clot coming from the heart, for example. Sort of the third major category of stroke is where there's narrowing in a large artery, like the carotid artery in the neck, and the blood flow through that narrowed carotid artery is just not adequate to perfuse the brain, and it dies a little bit. A sudden onset sensory problem, like numbness or tingling on usually one side of the body or another. Sudden onset paralysis or weakness, usually on one side of the body or another. Sudden onset speaking difficulty, unable to form words or understand words, slurring your words. Sudden visual symptoms, including blindness in one eye or blindness on one side, or eyes crossed and you're seeing double. Or maybe a sudden onset walking problem. The most common one is hypertension or high blood pressure, which is very strongly related to strokes and heart attacks. So high blood pressure is very important. Diabetes, high cholesterol, smoking, diet has some bearing. Alcohol has some bearing on risk of stroke. And then there are other diseases such as atrial fibrillation, which is an irregular heart rhythm, which can lead to a blood clot forming inside the heart, which can then leave the heart and go up into the brain. The primary ways are with CAT scans, CT scanners, and MRI scans. CAT scans are very quick. MRI scans are a bit more detailed. They both have their place. So the diagnosis depends on identifying the symptoms and signs, those are things the doctor sees, that are consistent with a blockage in the blood vessel, and then confirming it with imaging. The studies have shown that if we give a clot-busting drug, a thrombolytic drug called TPA, within 3 hours of the time the patient was last known to be well, that they stand a much better chance of getting better. And so it's important for patients to get here as quickly as possible so that we can get the evaluation done that we have to do, including a CAT scan and some blood tests, so that we can get this very important medicine into them. And some studies have shown that getting to the hospital via ambulance, even if you're only a block away, will get you seen quicker than getting to the hospital by walking that block or driving that block and walking in yourself. So the right thing to do for somebody with symptoms of stroke is to call 911. Preventing strokes is important and possible, and it's the way we do it is identifying the risk factors for stroke that any individual patient has. The most important one is hypertension. So know if you have blood pressure, and if you do have it, treat it. Know if you have diabetes, and if you do have it, treat it. Know if you have high cholesterol, and if you do have it, treat it. Eat well, exercise, don't smoke, drink in moderation, and go to the movies every now and then. Well, at Tufts Medical Center, we have what's called a stroke code system. So there is a bunch of pagers that all go off simultaneously when a patient with a suspected stroke hits the emergency room. And we descend and run through this system that gets people evaluated very quickly. We have a stroke council at Tufts Medical Center, which includes people from many different disciplines that meets periodically and reviews all the stroke codes, and also discusses any other issues having to do with the evaluation, the treatment, and the rehabilitation and discharge of stroke patients. Everybody comes together to individualize the treatment for that patient and then discharge them to an appropriate place that will allow for the continued therapy.